We have been treating high blood pressure the wrong way. What actually works takes just 15 minutes a day, and almost no one is talking about it. Most people think lowering blood pressure means long walks, bland food, and a handful of pills every morning. I am telling you that picture is outdated. There are 3 things you can do in 15 minutes that your cardiologist probably never mentioned. They are backed by clinical research. They cost nothing. And after 50, they work better than most people realize. Stay with me, because what I am about to show you changes everything. By the time you are reading a number on that cuff, 140, 150, 160, the damage has already been happening for years, quietly without a single symptom. High blood pressure does not hurt. It does not announce itself. It just works in the background, thickening artery walls, straining your heart, quietly narrowing the vessels, feeding your kidneys and your brain. Until one day, it does announce itself. And by then, the announcement comes in the form of a stroke, a heart attack, or kidneys that can no longer do their job. My name is Dr. Favor Adeyemi. Today, I am giving you 3 of those tools, and all 3 fit inside 15 minutes. Let me tell you about a patient I will call Brent. Brent was 67 years old, retired civil engineer. He was already on 2 blood pressure medications. His readings were still consistently around 148/92. His cardiologist had suggested adding a 3rd medication. Brent came to me for a second opinion. Not because he did not trust his doctor, but because something about adding another pill without changing anything else did not sit right with him. When I reviewed his daily routine, he was doing almost everything correctly. Diet was reasonable. He was walking. He was taking his medications on time. But there were 3 specific things he was not doing. Things that take a combined total of 15 minutes per day and that the research consistently shows produce some of the most significant blood pressure reductions available without a prescription. We will come back to Brent because his 6-week results are exactly what I want every person watching this video to know is possible. First, I need to give you the foundation because without understanding why these 3 habits work, they will feel like random tips rather than targeted science. High blood pressure after 50 is not primarily a salt problem. Yes, sodium management matters, but the deeper mechanism in most adults over 50 is arterial stiffness combined with reduced nitric oxide production. Here is what that means in plain terms. Nitric oxide is a molecule produced by the cells lining your blood vessel walls called endothelial cells. Its job is to signal the smooth muscle surrounding each artery to relax and dilate. When your arteries dilate, the space inside them increases. More space means less pressure. This is the same mechanism that most blood pressure medications target through synthetic pathways. After 50, endothelial cells produce less nitric oxide. The arteries become progressively stiffer because the elastic proteins in the vessel walls, particularly elastin, break down faster than the body replaces them. Stiffer arteries cannot dilate as well. Blood pressure rises because the same volume of blood is now moving through a less compliant system. The second mechanism is the autonomic nervous system. Your blood pressure is regulated by 2 branches of the autonomic nervous system. The sympathetic branch raises pressure. The parasympathetic branch lowers it. After 50, many adults are spending significantly more time in sympathetic dominance due to chronic low-grade stress, poor sleep quality, and the cumulative demands of daily life. Sympathetic dominance keeps blood pressure elevated even during rest. The 3 habits I am about to give you address both mechanisms simultaneously. They stimulate nitric oxide production. They shift the autonomic balance toward the parasympathetic state, and they do it in a combined total of 15 minutes. Habit number 1, slow diaphragmatic breathing, 5 minutes. This is the most powerful and most underutilized cardiovascular intervention in existence, and most people have never been taught to do it correctly. The technique is called slow diaphragmatic breathing, also known as device-guided slow breathing or resonance breathing. The protocol is simple. Inhale slowly through your nose for 4 to 5 seconds, breathing deeply into your belly so that your abdomen rises rather than your chest. Then, exhale slowly through your mouth or nose for 6 to 8 seconds, Repeat this cycle for 5 continuous minutes. Here is why it works. Slow breathing at this pace, approximately 5 to 6 breath cycles per minute, directly activates the vagus nerve. The vagus nerve is the primary pathway of the parasympathetic nervous system. When it is stimulated, it sends a signal to your heart to slow down and to your arterial walls to relax. Blood pressure drops measurably within minutes of starting this practice. But the long-term benefit is more significant than the immediate one. A meta-analysis published in the Journal of Human Hypertension reviewed 17 randomized controlled trials and found that regular slow-breathing practice reduced systolic blood pressure by an average of 9.4 millimeters of mercury and diastolic by 5.1 millimeters of mercury over time. Those are reductions comparable to a starting dose of a standard antihypertensive medication from 5 minutes of breathing every single day. A landmark study from Harvard Medical School found that a device-guided slow breathing program produced sustained blood pressure reductions of 10 to 14 millimeters of mercury in patients with resistant hypertension. Patients whose blood pressure was not responding adequately to 3 or more medications. The FDA has approved one such device specifically for blood pressure management. You do not need a device. You need 5 minutes and a quiet chair. Do this in the morning before you get up or in the evening before bed or both. The consistency matters more than the timing. Habit number 2. Isometric wall sit. 5 minutes. This is the habit that surprises people most, and the research behind it is one of the most significant findings in exercise medicine in the last decade. A wall sit is a static exercise. You stand with your back flat against a wall and slide down until your thighs are roughly parallel to the floor, as if sitting in an invisible chair. You hold that position. No movement, just sustained muscle contraction. This type of exercise, where a muscle contracts and holds without movement, is called isometric exercise. And a network meta-analysis published in the British Journal of Sports Medicine in 2023 analyzed 270 randomized controlled trials involving over 15,000 participants. The finding was remarkable. Isometric exercise produced the largest average reductions in blood pressure of any exercise type studied. It outperformed aerobic exercise, resistance training, and high-intensity interval training for blood pressure reduction. The proposed mechanism involves the sustained muscle contraction increasing blood flow through the working muscles, which stimulates the endothelial cells lining the blood vessels to produce significantly more nitric oxide. This nitric oxide-driven vasodilation persists well beyond the exercise session itself. The protocol for blood pressure benefit is 2 sets of a wall sit, each lasting approximately 2 minutes with a 1-minute rest between sets. Total time, 5 minutes. Beginners can start with 30 to 45-second holds and build progressively. The threshold effect appears to begin around 90 seconds of sustained contraction. If a wall sit is not accessible due to knee or joint issues, an isometric hand grip protocol produces similar benefits. Squeeze a hand grip device or even a rolled-up towel at moderate intensity for 2 minutes per hand. The mechanism and the evidence are the same. If you have made it this far, you are clearly invested. You want to see what happens next. But most viewers enjoy the content and scroll away without subscribing. If this one really means something to you, tap subscribe. It takes a second. If not, you will probably forget this channel exists and miss a lot of great educational content ahead. Before I give you the third habit, I want to pause because what I just described, 2 targeted habits totaling 10 minutes, is only part of the picture. The environment you create around those habits determines whether they hold. Over the years in my clinic, I have seen one simple truth. Real progress does not come from extreme changes. It comes from doing the right small things consistently. That is why I created the 30-day blood pressure reset for seniors. It is a simple step-by-step plan designed to help you support healthy blood pressure through gentle daily routines, light exercises, and clear guidance you can follow right at home. Some of my patients who followed this structure told me they felt more in control of their habits and more confident about their readings. I am keeping this very limited. Only 30 spots are available and 8 are already gone, so just 22 spots remain. If you feel like your current routine is not giving you the clarity or results you need, Click the link in the description or scan the QR code to secure your spot before it fills up. Because you are part of this community, I have made it easier for you with a 70% discount. After you get your copy, drop your email, and I will personally follow up with you, checking in and helping you stay consistent with the plan. Now, the third habit. Habit number 3, cold water face immersion. 2 to 3 minutes. This one will surprise you, but the physiology behind it is precise, well documented, and immediately applicable. Your face contains one of the highest concentrations of sensory nerve endings connected to the vagus nerve of any part of your body. Specifically, the area around your forehead, eyes, and cheeks is directly connected to the dive reflex, a hardwired mammalian physiological response that activates powerfully when cool water contacts the face. When cool or cold water touches the face, the dive reflex triggers an immediate involuntary activation of the parasympathetic nervous system. Heart rate drops, peripheral vascular resistance decreases, blood pressure falls measurably within seconds. A study published in Frontiers in Physiology found that face cooling with cold water produced significant reductions in heart rate and blood pressure within 60 seconds in hypertensive adults, with effects persisting for 15 to 20 minutes after the exposure ended. The practical protocol is straightforward. Fill a bowl with cool to cold water, immerse your face, or simply splash cold water thoroughly over your forehead, cheeks, and the area around your eyes. Hold the exposure for 30 to 60 seconds. Repeat 2 to 3 times. Total time, 2 to 3 minutes. Alternatively, apply a cold, damp cloth to your face and forehead for 2 minutes in the morning. The mechanism is the same. The vagal activation is the same. The blood pressure response is the same. This habit is particularly effective when combined with the slow breathing protocol. The breathing activates the vagus nerve centrally. The face cooling activates it peripherally. Together, the parasympathetic shift is more pronounced than either alone. I promised I would come back to Brent. 6 weeks after implementing all 3 habits, Brent came back for a review. He had done the slow breathing every morning before getting out of bed. He had done the wall sit in his living room every evening before dinner. He had started splashing cold water on his face every morning as part of his bathroom routine. His average home readings over those 6 weeks, 131 over 82, down from 148 over 92, a reduction of 17 points systolic and 10 points diastolic in 6 weeks with no change to his medications. His cardiologist, reviewing those readings, chose to hold the conversation about a third medication. For the first time in 3 years, Brent left a cardiology appointment without a prescription change. He told me something at that follow-up that I think about often. He said, "I spent 3 years thinking I had done everything I could. You gave me 3 things I had never tried, and none of them cost me anything." That is the gap. Those 3 interventions exist in the research literature. The evidence is not new, but they are not making it consistently from the journal to the consulting room to the patient. That is what this video is for. Let me close with the full protocol clearly laid out. 15 minutes, 3 habits every day, 5 minutes of slow diaphragmatic breathing at 4 to 5 second inhale and 6 to 8 second exhale, 5 minutes of isometric wall sit or hand grip exercise, 2 holds of 2 minutes each with a 1-minute rest between, and 2 to 3 minutes of cold water face immersion or cold damp cloth application to the face and forehead. None of these require a gym. None require equipment you do not already have. None require a prescription. All 3 have published randomized trial evidence behind them. Start tomorrow morning, not next week, tomorrow. Which of these 3 surprises you most? Tell me in the comments. I read everyone, and if someone in your life is managing blood pressure and has been told their only option is more medication, share this video with them. The research is here. The habits are simple. The only thing missing is the information reaching the right person. Before you go, think about this for a moment. Most people keep waiting for the perfect time to take their health seriously, but that moment usually never comes. That is exactly why I created the 30-day blood pressure reset for seniors. It is designed to help you follow a simple, structured daily routine that supports healthy blood pressure without confusion or stress. Inside, you will find gentle exercises, practical daily habits, and a clear plan you can follow step by step. I have seen people in my care feel more confident and in control just by sticking to something structured like this. I am keeping this very limited. Only 30 spots are available, and 8 are already gone, so just 22 spots remain. Once those spots are filled, I will be closing it. If you are ready to start something simple and consistent, click the link in the description or scan the QR code to secure your spot now. Because you are part of this community, I have made it easier for you with a 70% discount. After you get your copy, drop your email, and I will personally follow up with you, checking in and helping you stay consistent with the plan. Disclaimer: everything shared in this video is general medical and educational information based on current published cardiovascular research and clinical guidelines. It is not personal medical advice for your individual situation. If you are currently taking blood pressure medications, do not stop or reduce them without speaking to your doctor first. These habits are designed to complement medical treatment, not replace it. Always consult your physician before making changes to your health management plan, especially if you have a diagnosed cardiovascular condition.